everyone. First, before we start, I want to wish Legislator Hatzman a happy birthday. Thank you for being with us here tonight. So the November 29th, 2022 meeting of the Human Services Committee will now come to order. Will the clerk please call the roll?
Mr. Blankley.
Here.
Mr. Blankley is present. Mr. Brew.
Here.
Mr. Brew is present. Ms. Delvecchio Hoffman is excused. Mr. Dondorfer.
Here.
Mr. Dondorfer is present. Ms. Hasman.
Here.
Ms. Hasman is present. Chairman Keller is excused. Mr. Morris.
Here.
Mr. Morris is present. Ms. Smith.
Here.
Ms. Smith is present. And Mr. Udelson.
Here.
Mr. Udelson is present.
Is there anyone signed up for the public forum?
There is not.
This concludes the public forum. I'd like to introduce Robert Franklin, Chief Financial Officer of Monroe County, who is here to present the 2023 proposed Monroe County budget as it pertains to the Human Services Committee. We will have a question and answer period following the presentation.
Thank you. Here we go again. Come on. I'm new. All right, here we go. Thank you for coming to the Human Services Committee. I know you have to. This is a big committee, right? 54% of Monroe County's budget for next year amounts to about $726 million, most of which is accounted for in the Department of Human Services. Yeah, did I skip a page? There we go. That's the pie chart I wanted to show you. Budget spending for the whole county, $1.3 billion. Our human services and health accounts for about 54% of Monroe County's budget. Two-sided. You will see a lot of legislative referrals throughout the year to accept grants and awards. Hence, there is quite a large difference between the 22 adopted budget and the 22 amended budget. I will mention that the big jump in the health department that you see between the adopted and amended budgets for 22 was largely due to that $20 million transfer a few months back of ARPA funding approved in August. They're not always that large. Looking at our Department of Human Services, it is the largest department budgetarily in Monroe County. As a department, the overall DHS budget's barely changing, right? It's less than a $600,000 increase in appropriations, and for probably the first time ever, no change in total headcount. Within the major divisions, however, there is a lot going on. Obviously, the largest division within Human Services is the Division of Social Services. Their appropriations are actually coming down by about $2 million next year compared to this year's adopted budget. A couple things about that. There are 35 vacant positions within the Financial Assistance Division, which have been abolished, while 952 positions within the department have been upgraded. The department's total payroll increases about $5.5 million. It's about a 10.2% increase. And I'll point out that retention bonuses account for about 1.6 million of that increase. Employee benefits are also increasing, as you can imagine. It's about $1.6 million increase. And the interdepartment chargebacks that every department has are also increasing. It's about 1.6 million, but I'll say that's mainly related to the higher building costs. That's where we accumulate all the utility charges. And a charge back from our law department due to state changes in the representation within family court. All of these cost increases are offset by reduced appropriations for TANF, Temporary Assistance for Needy Families, and Safety Net assistance. That's the state program. Both TANF and Safety Net caseloads had been trending downwards prior to the COVID-19 pandemic. And then in 2020, those caseloads actually plummeted. When we were putting the current 22 budget together, we expected that caseload to trend back upwards where it left off at the end of 2019. But for whatever variety of reasons, that increase actually just did not materialize. So for next year's proposed budget, we again expect to open more cases, but our trend line has a lower starting point. So at least budgetarily, if that's a word, the appropriations needed next year for TANF and Safety Net are slightly less than what we budgeted this year. Within the Office of Mental Health, they have a $2.9 million appropriation increase, and that supports continued funding for the expanded forensic intervention team and also increased funding for direct provider service contracts. The two smaller divisions within Human Services, our Office for the Aging and our Youth Bureau, they're essentially maintenance of effort budgets, although they each have slightly lower appropriations. I guess notably, I'll mention the appropriations budgeted in 22 for the active transportation plan within the Office for the Aging are now grant supported. If I can look at our Department of Public Health, from an appropriation standpoint, it's a much smaller department than Human Services, but ironically, it's a little harder to summarize what's changing in their overall budget. As a department, the budget increases about $5.7 million, 8.4%. They are adding 33 FTEs compared to the 22 adopted budget, so their payroll is increasing by about $3.1 million. I want to point out of which of that increase, $328,000 relates to the retention bonuses. Employee benefits also increased the budget, another $1.5 million. A couple other highlights I'd like to point out within public health related to the opioid and addiction services. You know, we added $1.5 million to their 22 budget, and we're adding another $800,000 for the 23 budget. So their overall budget next year supports 26 new FTEs. Some of those have been added this year, and continued maintenance and resupply of about 500, we call them NOx boxes, Noxalone boxes located across the county. For public health education, we've added 2 new health educator positions, and that's to increase community engagement. And we'll also be adding 2 new bilingual positions to early intervention and preschool special education to better manage service coordination. And for the 3rd year in a row, the county executive has approved a 5% increase in the payment rates for preschool special ed related services. Related services would be the speech pathology, OT, PT, assisted technology. I'd like to make a quick comment related to the medical examiner's office, specifically their toxicology lab. We did add 2 new toxicologist positions, bringing the total number to 7, and we upgraded 3 of those positions to a more senior level in order to create a career ladder for promotable staff currently on the payroll. The other positions in the lab, because there's more than just the toxicologists themselves, the other positions in lab were also upgraded to align their pay groups with other county positions with similar requirements for education and experience. Very quickly, I'll turn to Monroe Community Hospital. The slide is kind of opposite what I generally show. Instead of detailing out the appropriations for MCH, I hope it's more beneficial to you if I highlight how the hospital funds its operating budget. Obviously, the largest is patient revenues, and that's patient revenues from all sources: Medicare, Medicaid, private insurance. Patient revenue represents an estimate based on the average projected daily resident census and our payer mix. For next year's budget, the average daily census, we're using an estimate of 425 beds. That does reflect a continuing trend we see in this community and throughout the country of families avoiding nursing home placements for loved ones. That's something that was exacerbated by the COVID-19 pandemic. Conversely, higher is our estimate of next year's Medicaid upper payment limit revenue, formerly called intergovernmental transfer. For those of you who need a refresher, this is a revenue stream that's annually negotiated between New York State DOH and the federal government. It provides municipal nursing homes with additional reimbursement because we serve a disproportionately high Medicaid population. So when the funding allocation is calculated, New York State tells us how much we have to remit to the state. They collect the same amount from the federal government, and when both amounts have been collected by the state, they remit the combined funding back to Monroe Community Hospital, hence intergovernmental transfer. Now called UPL, the upper payment limit revenue. You know, it had been trending downward over the past 5 years, but Leading Age, which is a lobbying and advocacy agency for nursing homes, is suggesting that the UPL trend is actually going to reverse itself and we should see additional funding in 23. There are some other revenues at MCH and they are running a bit lower. They really relate to their lease of space to other agencies, insurance recoveries, not health insurance. This would be like property insurance recoveries. Grant awards, yep, they do get some grants. They also host event planning and planning services and some other minor activities. Just real quick on the appropriation side, that lower resident census that we're budgeting for next year, it's not really driving a commensurate reduction in expenses, okay? Sure, there are some variable costs at MCH, and they are coming down, but the cost per resident is actually increasing a little bit. Overall, the hospital's total appropriations are virtually unchanged from the currently adopted budget. It's increasing just $631,000. That's a 0.7% increase. Their proposed budget does add 6 FTEs, so payroll is increasing about $1.8 million, of which retention bonuses account for about $956,000 of that increase. I'll point out, University of Rochester Medical Center is no longer going to staff our ventilation and pediatric unit. So MCH may scale down the ventilation unit and support its patients with contracted respiratory therapists. A final decision, I don't believe, has been made yet. And I did mention UPL revenue increasing. That also corresponds to an increase on what we have to pay the state. So our share of that expense is increasing by $3.3 million. And then wrapping up this presentation, our Veteran Services Agency. Ordinarily, you know, there's not much change from year to year, but 22 broke that record, and next year's budget will be no different. So the Veteran Services Agency's total budget increases $335,000. It does add 1 full-time equivalent employee. So of the $74,000 increase in payroll next year, I'll point out retention bonuses account for $16,000 of that. Past few committees, I've mentioned these retention bonuses. It increases the payroll budget for next year, but they do represent one-time costs. So at least the intent was those run through the calendar year and then not repeat in 24. More notably, I'd like to point out something I think you've all heard. We're increasing our contract with Tribe Ecotherapy, and that is for the intention of doubling the number of veteran cohorts that we're able to enroll in the program. And then lastly, I'll note that we've added additional funding to bring a total of $50,000 to support next year's Veterans Day Parade. That parade this year generated a lot of positive feedback from the community. And we're happy that we can support that going forward. So thank you very much. Happy to field questions once we get back to the table.
So I want to thank Mr. Franklin. As soon as he gets back to the table, I'll open the floor to any committee members who have questions regarding the human services portion of the budget. Legislator Dondorfer? Yes.
To the administration, What are the percentages of mandated versus unmandated costs for the Department of Health?
Madam Chair, we did not actually calculate department-specific mandate shares. That's something we'll have to run through over the next week or so and get back to the committee.
Thank you. Through the chair, on page 286, why are the training facility fees increasing by so much?
And thank you for the page reference, by the way. I'm sorry. Can you, I'm sorry, Madam Chair, can you repeat the question? Which specific,
The training facility fee increase?
oh, the tanning facilities.
Tanning, I'm sorry.
Yep, that's okay. There's
That's
actually
okay.
a couple different fees going on in there. There's a device fee and actually registration for the provider. It generates about $49,000 in revenue. Honestly, these two rates are set by New York State, and there was an increase in statute.
And through the chair, does the medical examiner's office have a plan to let the next of kin know when descendants' death certificates may be available?
Madam Chair, I'll have to bring in our health department for that.
Good evening through the chair. The plan has always been to communicate as soon as possible when the cause and manner of death are finalized by the medical examiner's office. They'll communicate with the family.
Through the administration, or through the chair to the administration, I know that there is a significant backlog in regards to the doctors signing off on the cases, some of them upwards of well over a year. I know that there are 2 new medical examiners that were hired. It's my understanding, though, that one of them may be walking out the door sooner than later for whatever reason. But is this going to speed up the process of getting these cases signed off on?
Through the chair, we did lose one of the associate medical examiners last month. We are working very closely with Dr. Granger and her team to look at the processes that they utilize to finalize these cases. And our goal is to make a substantial reduction in them in calendar year 23.
Through the chair to the administration, will the addition of the new toxicology positions help with that backlog at all? Or is it all on the doctors, more on the doctors than the toxicology?
Through the chair, it's a little bit of a pendulum. You know, getting it exactly right is very difficult. But certainly anything that we can do to speed up the process on the tox side will help the medical examiner. But I wouldn't say that we would see an immediate improvement in that, because currently the backlog is much more heavily on the ME side than it is on the toxicology side.
Thank you. Through the chair to the administration, on page 274. Is there a concern that the number of births and deaths in Monroe County are about even at this point?
Through the chair, I'm not sure what you're asking. That has been generally the case in Monroe County.
Okay, so it's not a cause for concern that they're right about the same?
Correct. No, that's been standard for a while.
Also on page 274 is Narcan distribution programs have expanded each year since it started. Do you have a goal of the maximum amount of kits that you would like distributed annually?
Through the chair, that's something we're looking at very closely. We know that about 75% of the overdoses occur in private residences. So while we are looking at total volume, we also want to pay attention to the location of these Narcan kits. So I wouldn't say that we're, targeting a certain number by year. Ultimately, the goal that we're trying to achieve is to reduce the overdoses. And it may be that we distribute fewer Narcan kits, but do so in a different way, i.e. into the private residences of those who use drugs. And we may actually see a decrease even though we're distributing fewer kits.
Kind of a side question through the chair. Didn't a couple years ago we have a program with the pharmacies that were giving Narcan to people that were on certain prescription drugs? Was there any feedback on how that had worked? I mean, is that still going on? Did it work? Is it failing miserably? Is it?
So correct, through the chair, for those who don't recall, Mazy's Law now requires pharmacies in Monroe County to offer a prescription to those who are picking up a prescription for opioid-containing medications. We are working very closely with the commercial pharmacies because that's the only way we can get the data. And our chief pharmacist is currently conducting that study right now. You know, there are certainly opportunities for improvement. I know that some of the pharmacy chains haven't gotten on board with this yet, but the major pharmacies have.
Okay, great. Through the chair to the administration on page 276. Why are the clinical and outreach visits so much more lower in 2022 than projected in the adopted budget?
Through the chair, are you referring to a particular line? Are you looking at immunizations, for example, going down by 100? Or tuberculosis going down by 800?
Which just says clinical and outreach visits. So I'm not sure
Oh,
if
page
that's
274, sorry. What page are you looking at?
276.
Oh. Oh, as a whole. I see. PB. Through the chair, to speak directly to the tuberculosis numbers, we saw fewer refugees in this calendar year, which is why we saw fewer tuberculosis visits. We actually anticipate that number potentially going up in the next calendar year. And I think that's the major driver for the decrease in outreach visits. Through the chair.
And through the chair on page 278, why is there an estimation of a 123% of targeted WIC cases, caseload achieved? Why isn't that just the target number in the first place?
Through the chair, the way we measure it is based on a recommended capacity from the state, and we're already operating at 123%. And so we just have to calculate that percentage based on the state requirement.
Okay.
So
And through the chair on page 282, what is the estimated number of cases from outside Monroe County that will be investigated?
through the chair, we'll have to get back to you on that one.
Okay. Through the chair, also on page 282, in budget objectives, it was stated, increase budget to improve turnaround times. Why aren't turnaround times listed as key performance indicators? Total cases aren't measured. And what is the reasonable expectation for completion of death certificates? And I think he actually already answered that one. So I'll just go, I'll skip over to page 289. How many inspections and permits are requested in regards to the death certificates?
Can you repeat the question? You're referring to page 289?
On page 289, yep, but in budgeting objectives, I believe it's going to be in the same thing. It just says how many inspections and permits are requested and are demands being met. puts us in.
Through the chair, can you clarify? I think I heard a question about death certificates.
How about I get back to you on that one?
Okay. Thanks.
Through the chair to the administration, on page 272, why does the Administration and Special Services Division have such a significant difference between the adopted and amended 2022 budget? And do you expect the 2023 budget to be amended in a similarly large amount?
Madam Chair, I'll field that one. The Administration and Special Services is so much higher in 22. That's where we put the $20 million of ARPA funding for direct COVID-19 response and mitigation actions. That $20 million transfer to public health really was supposed to last a couple years. So that's a long-winded way of saying, no, we don't expect to repeat such a transfer in the 23 calendar year.
Okay, and through the chair on page, to the administration on page 273, personnel services and admin and special services are rising nearly $3 million and $1.7 million respectively. Can you explain where this increase is going and why?
And personnel, Madam Chair, personnel services?
Personal services and admin and special services on page 273.
Madam Chair, page 273 accounts for a variety of offices within admin. Our Vital Records Office, this is where we have our opioid and addiction services team impact. And this is where we put the $20 million COVID-19 response. Personnel services, quite the decline from the amended budget to the proposed budget, and that is basically because in personnel services, we had $4.76 million of the $20 million ARPA funding that's included in 22. There's some grants, minor. I will say, though, for personnel services within this division, I did comment on my presentation. We are adding about roughly 26 FTEs to the impact team. So that'll be a significant driver in 23.
Through the chair to the administration, why is the supplies and material line item decreasing by so much when everything is going up in prices?
So there's, Madam Chair, there's actually two things. Obviously, the big one is it included about $9.28 million in related to pandemic response. I'll also point out the amended budget for 22 included $750,000 for the impact team. In my presentation, I mentioned the county added $1.5 million to impact. We split that $1.5 million, $750,000 in contractual services, $750,000 in supplies and materials. That was not the full plan at the time the budget was being prepared. The full plan was still being developed. As it turns out, instead of spending the money on contractual services and supplies, we're going to use that to fund the additional staffing.
Great, thank you. Through the chair to the administration on page 275, why were personal services increased by by over $500,000 in 2022? And do you foresee a similar raise after the 2023 budget is adopted?
Yes, Madam Chair, I do. This is really responsible. It's grants driving about $579,000 last year, this year, and those grants generally repeat themselves.
Through the chair to the administration on page 276, nursing services, a small portion of the budget, a small money portion of the budget, but a serious percentage increase. There are not significant differences in performance measures. Why the increase?
Madam Chair, within nursing services, there may not be a significant change in performance measures, but I will point out that the amended budget included significant grant funding in 22 that will repeat itself. The other increase I will point out in contractual services, You'll notice on page 275 for nursing services, contractual goes from 2 million and change to $2.5 million and change. And we're seeing significant increases in our contracts for the Univar clinical staff at our clinics and significant increases in our contract with RGH for laboratory services. Those are the two biggest drivers of increases in that line.
Thank you. Through the chair to the administration on page 279, what positions changed and how can you explain what they will do, why they are necessary, and if so, how will they help reduce the backlog?
Well, Madam Chair, I guess I will start out the answer and we'll let our public health staff address the how it works. Within the Office of Medical Examiner, the personnel changes are really related to the toxicology lab. And we've had a couple conversations with our chief toxicologist and Dr. Mendoza is our public health director. Toxicology, we've had a number of conversations in this chambers regarding the medical examiner's office and delays. In prior years, I've been here a while, toxicology lab has been the problem. It's not the problem right now, but we don't want it to become the problem once the medical examiner clears through its pathology cases, right? The staff within toxicology lab have been somewhat stagnant for years. And first of all, to prevent the problem, we're adding staff. We're adding 2 toxicologist positions. But it's also important to create a career ladder for these folks, right? We have right now 5 toxicologists. We're going to 7, but we're also 3 of those will be a senior position, right? We got to give them a career ladder because some of them have been around a while and they're quite promotable. And quite frankly, they can take a job somewhere else in an environmental lab, any kind of scientific lab, crime lab. So with those upgrade, and then the rest of the lab has evidence technicians, a lab manager. Those positions are also being upgraded as well. We took a look at the level of education and years of experience required in those positions. Frankly, I compared it to the controller's office because when I look at job descriptions for accountant and toxicologist, they have pretty much the same requirements in terms of education and experience. And since I have degrees in accounting, chemistry, and biology, I'm pretty confident that I can say that the level of responsibility and the consequence of error is commensurate between the 2 different positions. So we felt that those upgrades were quite warranted. Chief toxicologist wants to tag team, please.
Okay, so it is. Through the chair, oh, there we go. I would echo everything that Mr. Franklin just said and add the fact that we have been stagnant for a long time. And this has been a problem, the lack of career ladder in the tox lab for not just my whole career there, but my predecessors as well. And what we saw just in a period of 16 months was the loss of half of our analytical staff because they had nowhere to go. And they were able to get better jobs at our labs next door, in the crime lab, and all over the country, but also right here in Western New York. Commensurate positions are paid much better than they are. So they really have no incentive to stay. After we take the time to train them really well, then they're very well qualified to go and get more money elsewhere. And so they do.
Great, thank you. And through the chair to the administration, I completely agree that we have lacked in pay structure there to get people to hold these positions. And I'm fairly confident that's why there's been such a difficulty not only getting qualified people for your position, but for the medical examiner's positions as well, because I know that's not on top of medical school, there's more school on top of that, which is always fun for people, I'm sure. Through the chair to the administration, why was there no appropriated fund balance to be used in 2023 in regards to that?
Madam Chair, that really, in regard to the medical examiner's office, the appropriate fund balance comes from our reserve for bonded debt. It was available in 22 budget, and we've exhausted that reserve.
All right, over there. Through the chair to the administration on page 534. I know you touched base on it a little bit with your presentation, but why did the salaries in the administration and special services divisions go from 2.1 million in the adopted budget to 7 million in the amended budget?
Madam Chair, yes. So when we included that $1.5 million for the impact team, again, it was split between contractual services and supplies. And once the real plan was more fully developed, the decision was made to instead add staff to the impact team to double their community outreach and street outreach efforts and bring them to a 24/7 operation.
Thank you.
You know what, Madam Chair, I will also point out, again, this is the area that has our $20 million ARPA funding. Salaries included $4.76 million for that initiative.
Thank you. Through the chair to the administration on page 537, why was an additional $500,000 added to the 2022 adopted budget for salaries? Is that because of the increase or the retention bonuses?
Actually, Madam Chair, that's really grant related.
Grant related, you said?
Yes.
Okay, thank you. Okay, through the chair to the administration on page 537, computer software is increasing significantly. Are we upgrading computer systems or programs?
Oh, yes, yes, we are, Madam Chair. Public Health released an RFP, and as a result of the proposals, has selected a new electronic health record from Patagonia. There either will be or has recently been a legislative referral for that contract.
Thank you. Through the chair to the administration on page 538, why is the interdepartmental charge with information services increasing so much?
Madam Chair, you're going to see increases from the IS, this particular information services line throughout this budget book. Their budget actually expanded, I'm going to say roughly $1.8 million. And they spread their costs throughout the county based on a variety of factors. Could be software licenses, the number of machines issued, et cetera. So that's really just our behind the scenes shared expense allocation.
Thank you. Through the chair to the administration on page 539, I guess it's a similar question. Why is the amended budget for salaries in the maternal and child health services division in 2022 so much higher than the adopted budget? And what do you foresee? Do you foresee a similar increase in 2023?
Yes, Madam Chair, I do see a similar thing for 23. Maternal and child health services really accounts for our nurse family partnership, WIC programming, Starlight Pediatrics. So there's a lot of grant funding. It's about $1.3 million. So that'll repeat itself.
Thank you. Also on page 539, through the chair to the administration, there was a significant budget amendment for cell phones.
Madam Chair, we typically do not, in the adopted budget, include a large amount for cell phones, but it is grant funded, and we use that grant to support that administrative type cost.
Love it. And through the chair to the administration, also on page 539, where did the steam and water utility come from, and why is it not in the 2023 budget?
Again, it's pretty much a similar answer. We don't technically shoot to budget right up front in the proposed. We wait for the grant. So there's $147,000 in grant revenue behind that line.
Thank you. Through the chair to the administration on page 541 in regards to the medical examiner's salary budget going up, obviously for the increase in staffing. Why are overtime and temporary help costs also going up?
Madam Chair, honestly, temporary help and overtime follow most of these staff are CSEA, right? So they're going to follow either CSEA or M&P staff. So they're going to follow the CSEA contract. So with the normal course of contractual increases or step increases, you'll see that in overtime and temporary help.
Okay. And through the chair to the administration, also on page 541, why are agency contracts going down? Are we doing more things in-house at this point?
That really is our contract, Madam Chair, with NMS Labs, and that's for toxicology lab services. And that probably is just an estimate on volumes.
Okay. let's see. So through the chair to the administration on page 545, why did the 2022 amended budget for Special Children's Services Division have less salary than in the adopted budget?
Ironically, Madam Chair, I will say this is grant related, but in a little twist, the grant actually returned $8,000. So that's a little $8,000 reduction.
Gotcha. And through the chair to the administration, what positions are the additional $300,000 in salaries going to in the 2023 budget?
Madam Chair, there's a lot of positions within early childhood development. And by the way, sorry to public health, we did reflect the new name early childhood development in the department section of the book, but we didn't update our system. So we're going to change special children's services on page 545 to reflect early childhood development when we publish an adopted budget. So just want to get that out of the way. There are 2 FTEs being added to early childhood development. Those are the bilingual assistant health service coordinator positions to improve service coordination. But the other dollars behind the increases are really just contractual pay and step increases.
Thank you. A couple of revenue questions for you through the chair to the administration on page 680. Why are insurance recoveries going down?
Madam Chair, while I don't have a note, I did have a prior conversation, and I do believe there is fewer walk-in traffic, and that's usually where we'll charge. They bring their insurance card or Medicaid card, and we'll charge insurance. So if there's fewer walk-in traffic, there's going to be fewer opportunity for insurance recoveries.
Thank you. Through the chair to the administration on page 682. Why is no fund balance being used for the ME's office after $165,000 was last year?
Madam Chair, that was our reserve for bonded debt.
And through the chair to the administration, what is included in miscellaneous revenue?
Madam Chair, miscellaneous revenue really counts for the intermunicipal agreements we have between the medical examiner's office and other counties.
Great, thank you. I apologize, I've never asked so many questions before, but I yield the floor.
Have any other questions?
Yes, thank you,
Legislator
Legislator Dondorfer. I do have a few questions. To the chair, what are the percentages of mandated versus unmandated costs for the Department of Human Services?
Although, Madam Chair, we didn't run department-specific calculations for mandates, I'll have to follow up on that. Not going to lie, remember, it's probably 99.9% mandated.
Why am I not surprised by that? Thank you. Next question is, to the chair, do you project further expansion of the FIT team?
Madam Chair, we are using deferred revenue to fund what we have already expanded on the FIT team, and at this point in time today, we are not planning to expand it further.
Okay, thank you. Through the chair, will there be any class of incarcerated individual who will not be transferred from probation to Children and Family Services under the recent legislation raising the lower age of juvenile delinquency?
I'm going to pull in our Department of Human Services staff for that one.
Yeah, thank you. Through you, Madam Chair, can we just repeat the question, please?
Yes, certainly, Director Wright. To the chair, will there be any class of incarcerated individual who will not be transferred from probation to Children and Family Services under the recent legislation raising the lower age of juvenile delinquency?
Through you, Madam Chair, no, that's the whole hopes with the lowering the age, is that we're moving those young folks from probation, moving them to Child and Family Services under our Family Access and Connection Team to provide resources and services to family to reduce, if we can think about that pipeline to the criminal justice system and provide those services to the younger adults as a result.
Chair and Administration, thank you. It's a very thorough answer. Appreciate that.
Thank you, Legislator.
Through the chair, on page 179, what consists of an intentional program violation and fraud?
One second, through you, the chair, I'm going to ask my Deputy Commissioner over Administration to answer that.
Good evening, Denise Reed from Monroe County DHS. Through the chair, intentional program violation is an actual disqualification. Could happen on temporary assistance or SNAP if we determine, along with the Office of Administrative Hearings, that a person has committed fraud to the level of being disqualified from those two benefit programs. The length of time that a person is disqualified is dependent on how much of an overpayment that was created by the fraud. Through the chair.
Okay, as a follow-up question to the chair, so the length of time that the individual is removed from the program, is that based upon a common worksheet or chart, or is that based upon individual assessment of the violation?
Through the chair, it is based on state regulation. So there are set amounts. A certain amount of overpayment or fraud it equals a certain disqualification time period. And I don't have those in front of me. I apologize. Through the
Okay.
chair.
Just so, and to the chair, just so I have an understanding. So could you give me an example of what a program violation would be versus a fraud committed by the recipient?
Thank you. Through the chair. So I didn't know you were referencing a certain page. So absolutely, we do investigations of fraud based on referrals from workers when information is discovered that was not reported, because any of those infractions could be indicative of fraud. So that's why you see so many more actual investigations. But in order for a person to be convicted, I guess that's the way you would describe it, of an intentional program violation, there's actually a referral that's made that is then heard by an administrative law judge where the person is disqualified for a certain period of time because of the fraud. Sometimes we just initiate an overpayment, which says, oh, you didn't report that you were working, you received $600 more benefits than you should have. We're going to recoup that $600 from you. We're not going to pursue a program violation. We just say, maybe it was a mistake, maybe it was an oversight. When there's actual fraud that we suspect and we want to disqualify the person, I'll just give you an example. We had one this year that was actually prosecuted. There was an extensive amount of fraud, years of an overpayment, almost $30,000. And we did want to pursue criminal charges of that person. They pleaded guilty to welfare fraud, and now they have an intentional program violation for 5 years that they will be unable to collect SNAP because of the amount of overpayment that was discovered. So there's a set amount in state statute based on the intentional program violation. You could have 1 year, you could have 3 years, you could have 5 years, you could have a permanent disqualification depending on what the investigation uncovers and what we decide to pursue, whether or not the district attorney will prosecute, and then whether or not we get an actual affirmation on the disqualification from the Office of Administrative Hearings through the chair.
All right. Very good. Thank you very much. Response. Next question through the chair on page 182. After 2021, had roughly 1,200 fewer secure detention care days. You estimated 2022 to be around 3,000. Why did it go up to 5,352, and why are you projecting about 1,000 more this year?
Through you, Madam Chair, it's just the forecasting out, between the CDC with the specialized and the secure specialized program, we've seen a tremendous increase, not just unique to Monroe, but also statewide on the admissions of what we call juvenile delinquents, juvenile offenders, and more so our youth that are coming in under raise the age as adolescent offenders. To add insult to injury, we're also seeing longer lengths of stay, where at times we have to negotiate with other detention centers statewide to be able to transfer youth so we could have bed capacity specifically for our Monroe County youth.
Okay, thank you. And a follow-up question to that through the chair of the administration. Would you say it's because of the previously passed raise the age juvenile delinquency legislation?
Through you, Chair, I would say we saw a huge increase since the raise the age legislation, going almost like to 3 years now as we've been tracking the data. So I could say that is probably true, but would like to kind of just break it down a little bit more and be able to give a specific around the data.
Okay, thank you very much.
You're welcome.
Through the chair on page 196, why do you project the number of senior citizens served to remain flat in 2023 after exceeding the projection for at least the last 2 years?
Through the chair, our director of the Office of Aging, Steve Newcomb.
Through the chair, that number may be flat because folks are either in skilled nursing environments where previously they were being served in the community, and there are also folks that are aging out or passing, I should say, as well as some baby boomers are not identifying as of yet as an older adult. But eventually they'll come into the equation once we begin serving them. Through the chair.
Okay, thank you. And through the chair, I'd like to for the record state that I am a baby boomer and I'm not declaring myself an older adult quite yet. The next question, why were there so fewer wellness program special events than estimated in 2022?
There's a couple of mitigating factors. One was the post-pandemic ripple effect. We had a couple of intergenerational events that were either canceled or excluded younger adults because of the schools are in various forms and fashion may have been closed, excuse me, or limiting their students for outside extracurricular activities. Excuse me. I'll give you another example. We're having our salute to or our holiday ball in a couple of weeks, and that we hope to change it back to an intergenerational senior ball in future years. But we found for this year, some of the schools are reticent to allow their students to get together with the older adults in an indoor setting.
Okay, thank you. The next group of questions are appropriation-related questions. Through the chair on page 168, why are the appropriations for public assistance benefits going down?
Madam Chair, the primary driver of reduced public assistance benefits is the reduced caseloads for our TANF and safety net assistance programs. As I had mentioned, the 22 adopted budget, we tried to pick up the trend where it was heading prior to the COVID-19 pandemic. Those cases did not materialize, and during this current calendar year, our TANF and safety net assistance caseloads are running far lower. We're still, again, trying to, for next year, pick up that trend line, but we're at a lower starting point. So even though we are allowing for an increase in the number of TANF and safety net assistance cases from where we are today, that increase still brings us about $10 million below where we budgeted 22.
Okay, thank you. And follow-up question, same page to the administration. So why is the debt service going up so much?
Madam Chair, our debt service is really related to the Children's Detention Center, and as this body knows, we have a new capital project going on.
Thank you. Next question, through the chair on page 169. Are these allocations going down simply because we are receiving less money from the feds and state governments?
Madam Chair, most of these block grants fluctuate from year to year, and it really depends on how New York State chooses to use its federal funding and allocate that to the local districts. These not all performance-based. Some of them have a performance component, like our foster care block grant. They look at our trends in foster care placements relative to the trends in other counties. So we may have fantastic performance, but the other counties have extraordinary performance, therefore we don't get as big of an increase.
Okay, thank you. Next question is through the chair on page 171. Why are interdepartmental charges going up by about $700,000 over last year's adopted budget?
Madam Chair, the biggest drivers are two areas. Just the increase in building costs, which really reflect all the costs of being in the building, primary utilities, but also chargebacks from our law department due to changes in representation within family court.
Thank you. Next, through the chair on page 181, why are personnel services going up by 1.7 million?
So, Madam Chair, this is where we have quite a big change in our budgeting. This is within our Children's Center, Detention Center. Next year's budget, we have a 39 FTE increase. And we also upgraded 90 positions within that budget. Just the demands being placed on our detention facility in Rush. Commissioner Wright was very nice. I'm not so forgiving in terms of New York State. New York State has an issue on their hands. They have more children than they have beds to place them. And they are really looking for us to lend them a helping hand. So Commissioner Wright is working with the Sheriff's Office and our environmental services engineers to have a number of beds reconfigured at MCF, the Monroe Correctional Facility over by MCC. And you have to staff that, whether you have 6 kids there, 8 kids there. So that explains the 39 FTE increase there. And I'll also point out, we have these retention bonuses, again, 23, then they should go away. It's about $124,000.
Okay, thank you. And on the same page through the administration, that's page 181, is the additional 2.1 million in state aid from grants, or is it just what the state is giving?
Madam Chair, there's actually 2 components there. Secure detention is reimbursed by New York State 49% of our cost. Every year we submit a cost report and they give us our per diem rates. Specialized secure detention, that's really raised the age. New York State gives us 100% reimbursement for that.
Thank you. Next question, through the chair on page 183, are there going to be fewer staff members in the Welfare Management Support System Division, or why else is there a drop in personal services appropriation?
No, good eye, Madam Chair. There's actually a shift of 2 FTEs out of that office.
Thank you. Through the chair on page 186 to the administration, page 186, how much money do you think will be added to the amended budget for public assistance benefits in 2023?
Madam Chair, I would expect no money to be added to a 23 amended budget for public assistance benefits.
Okay. Next question, on page 188, why is the daycare budget going down?
Okay, this is a big change on this page, Madam Chair, and I don't know if there's a question behind this, but I'm going to point your attention to the language at the bottom of the page as well. In the column for the amended budget for 22, I'm going to tell you when we built the 22 budget, I was tired, been doing this a long time, I was tired of the constant year-to-year fluctuations in projected subsidy program enrollment, the cost per case. I've said that Department of Human Services, the most complex funding stream in the entire county, and within the department, I will say daycare is by far the most complex arrangement of funding streams for one particular program. We decided in 22 to budget all available funding we had for daycare. So this would be our state allocation through the Child Care Block Grant and rollover funding from unspent allocations in prior years. We could have done that for the 23 budget, but it would have been a little ridiculous. We have almost $100 million in available funding, and I think my opinion would have been disingenuous to budget $100 million for daycare subsidy benefits when we're not going to spend it. It's a reasonable projection, 61.66 million, based on where the number of subsidy payments are being made today versus where we project for 23. And I say that because as more people in our community return to work, they're likely in need of daycare. I will also say that enrollment in the subsidy program has not rebounded to pre-pandemic levels. So the Department of Human Services is actually budgeting money, I think $50,000 for, believe it or not, advertising campaign that we have funding available. If that's successful, or if enrollment takes off further than we have reasonably projected, I included language at the bottom of this page to say, essentially, look, we have $98 million in change in available funding. Should the need arise, we'd like, through adoption of this budget, permission to amend our budget to add the available funding to our public assistance benefits. This is not like several referrals in public health where New York State told us, Should funding become available at a later date, we'll allocate another $1 million to you. This money's already been allocated. It's just waiting for us to claim it.
Thank you. Next question, through the chair, could you explain the appropriation changes on page 189 for adolescent care?
Yes, Madam Chair. Adolescent care is another program that fluctuates quite a bit because there's a lot going on in here. First and foremost, that first line, JD and PINS care. This is expensive care. However, the cost per placement has actually come down. In the 22 budget, we had just over $204,000 per placement, believe it or not, that much. And we had 6 placements budgeted. We're actually not experiencing that kind of service demand, so we're budgeting 4 placements at a reduced $137,000 per placement. The juvenile justice facilities, that's just a chargeback we get from New York State for children placed in state facilities. For non-secure detention costs, that's actually going up quite a bit. Although there's no longer any state reimbursement for non-secure detention, it's likely that at least some of those placements will be youth who are raised the age eligible, so we should get some reimbursement for them. But the demand for non-secure placements is there.
Okay, thank you. Through the chair, could you explain the appropriation changes on page 191 for child welfare?
Madam Chair, yes. Again, there's a couple of them here. Adoption subsidies, the first line. It really is the same anticipated number of placements next year. It's just we're seeing an increase in the cost per case. Within our foster care, we're actually having a little better success in programmatic delivery. So we're projecting actually a decrease in the number of foster care placements with just a nominal decrease in cost. But that drives, $4 million worth of reduced appropriations. Our residential and transitional care, the independent living, and special children services, which these are just maintenance costs, so it's room and board. The placements are made by the school districts, but this is for like Easter Seals placements. We're responsible for the room and board. So really, the projections are based on where we see the caseloads today, and there's not a lot of change going forward.
Okay, thank you. Through the chair, going to page 195, why are agency contracts going down by about $500,000?
This is really grant related, Madam Chair. All of it. Well, 430 grand, Madam Chair. I did make myself a note. There's another $81,000 shift, pulling $81,000 out of our agency contracts and bumping it up to the line right above that, other contractual services. Basically what we're doing is we're insourcing again our event planning services.
Okay, thank you. And on page 197, why is there about $350,000 less in agency contracts for the Youth Bureau?
Madam Chair, again, to a small extent, we are insourcing the event planning services related to the Youth Bureau. That's, again, about $81,000. Really, the question is more appropriately answered the fact that in the amended budget for 22, we actually added $250,000 of additional funding, and the service delivery just didn't materialize. And it wasn't requested again for 23 based on what we're seeing today.
Okay, very good. Thank you. Next question through the chair on page 199. Why are personnel services going up by $215,000?
So, Madam Chair, within Office of Mental Health, we are adding an FTE. And again, I'll point out $18,000 of retention bonuses. But really, Madam Chair, the more significant driver of this increase is the new staff we've been able to bring into mental health is really demanding higher pay. So in civil service, they're not starting at step A of the schedule. They're starting at a much higher step, G, H, I.
Thank you. And through the chair, moving to page 506, why did the salary line item go down in the 2022 amended budget?
So, Madam Chair, our Staff Development Office is actually seeing a little bit of change. We had a senior caseworker, a casework supervisor and a senior examiner, knowledgeable programmatic staff to help deliver staff development training, actually moving back to their programmatic areas. We are bringing on a staffing specialist, however, within the Staff Development Office. So it's really only a net reduction of 1 FTE. And that staffing specialist is going to help DHS with new recruitment of employees. So basically, most of this is the net reduction of an FTE.
Okay. Next question refers to page 508. Why are salaries going up over 1.6 million for the Children's Center Division?
Madam Chair, this really is directly relates to a previous question on earlier in the budget when we were on the Children's Center Detention Center page. I commented we're adding 39 FTEs and there are 90 positions that have been upgraded in the detention center.
Okay, thank you. Makes sense. On page 509, what is the debt service fee for?
Again, Madam Chair, this is a budget for our Children's Center, and it's the capital project for our new facility in Rush.
Next question referring to page 510, why is worker compensation so much?
Madam Chair, workers' comp, unemployment, liability, those chargebacks are spread based on a 3-year rolling average of actual experience.
Okay. And as a follow-up question through the chair, is it related to some of the attacks that have occurred in the youth detention center?
Well, Madam Chair, it may be, but I cannot say definitively.
Through the chair, on page 521, what is the $600,000 of postage used for?
Madam Chair, can you just direct me to the account line? Oh, 504-630? I'm sorry. There is an increase in postage, right? We also have on this particular line mandated client notices related to the SNAP program. Those are relatively new.
Okay, thank you. To the chair, on page 525, why is the computer equipment line increasing so much?
Computer equipment, Madam Chair, really relates to really not that much. It's a $4,000 increase. But we are putting in within the Youth Bureau. They're, by the way, Youth Bureau. They're not at Westfall Road. They're over at Monroe Community Hospital. So we are having IS install an additional wireless access point. And they're looking for tablets with requisite docking stations.
Yeah, $4,000. Agreed to the chair, $4,000 is not a significant increase, okay? But next question on page 526, why are agency contracts reducing by over 200,000?
Madam Chair, when we were looking at the Youth Bureau's page earlier in the budget book, I did mention we had added $250,000 to the Youth Bureau, but the service provision didn't materialize and it wasn't requested again.
Yeah, thank you. I thought this was related to the chair. Through the chair, on page 529, why are salaries increasing by almost 200,000 in the Mental Health Administration Division?
Madam Chair, again, within mental health, we are adding an FTE, but the new staff we're able to bring into mental health are simply demanding a higher rate of pay. So they're coming in at a higher step than entry level.
Okay, thank you. And through the chair, I know you've mentioned some things relative to this next question. On page 530, why is the law department interdepartmental charge going up so much?
Madam Chair, would that be the non-ICAP chargeback from Law Department, 971601.
Actually, I don't have the page in front of me, but,
Well, I'm going to assume that is, Madam Chair.
okay.
That really is just a reflection of just like everyone else, most of the law departments are M&P staff, right? But we follow the CSEA contract. So this is requisite pay increases associated with the contract and step increases.
Good. Okay, next question, through the chair on page 531, why is there interdepartmental charge with purchasing in 2023 and there was not in 2022?
So we do, our ICAP charge is a little funny, Madam Chair. We do spread them twice. That's why you see IC1 and IC2. The budget is mostly aligned with IC2, ICAP 2. But the actuals just hit the ICAP 1 line. They hit both lines, but most of it's one.
Thank you. Next set of questions are revenue-related questions. Through the chair on page 168, why is no appropriated fund balance being used for this year?
I think I know the answer, but I want to get to the page, Madam Chair. Yes, Madam Chair, the $361,000 in the 22 amendment budget is all reserved for bonded debt.
Thank you. Next question to the chair on page 666. Why is the proposed revenue going up by 3.6 million? And do we expect a similar difference in approved versus amended numbers that we've seen with the 2022 budget?
Oh, yes, Madam Chair. This particular page is our child care block grant. So you will not see, well, you may, Madam Chair, see an amended number if enrollment exceeds our projections and we seek to appropriate the additional allocations we have.
Okay, thank you. And through the chair on page 667, why is there a significant decrease in the repayments of the adolescent care line item?
Madam Chair, that is really a function of where we budget and where our Controller's Office posts the revenue.
Through the chair on page 674, why is state aid going up by about $60,000?
Sorry, 674, Madam Chair?
674, yes, through the chair.
Madam Chair, state aid for our youth bureau really is allocation driven, and it's based on the resource allocation plan we submit within our child and services plan. So this is really an expectation based on service provision.
Thank you. Makes sense. Next couple of questions will conclude my questions. I have three more. These are personnel questions. Through the chair on page 726, why is there no increase in the number of caseworker positions? Is it because they're not currently all filled as it is now?
That's it, Madam Chair. There are 242 authorized caseworker positions. Pre-pandemic, and I look from 2014 to 2020, we averaged 197 of those filled, but we're down another 40.
Yes, expected response. Thank you. Through the chair, is there a youth bureau director in place, or will it be one, or will there be one soon?
Through the chair, we're in the process of finalizing the offer with the new Youth Bureau Director with the hopes to make an announcement next month.
Thank you. And the last question, through the chair, are there plans to increase the salary ranges for the Federation of Social Workers?
Madam Chair, the Federation's contract expires at the end of 2023, and I don't think the administration should comment on pending or upcoming contract negotiations.
Okay. Thank you. That concludes my questions, and thank you. Thank you very much.
Before we go on to the next legislator, I just want to ask the administration, getting back to a question that Steve or Legislator Brew had. Going back to that page 530, and the question was the increase on the law department. Were you referring to line number 989020 when you answered that question?
Madam Chair, I was looking at account 971601. It's our fee-for-service law, non-ICAP chargeback. Went to $35,628, up from a budget of $30,331. Is there another line I should look at?
Yes. Do you mind answering why the increase on line 989020? It's the IC2 Law Department. It went up from $21,850 to the $50,784.
I can't point exactly to that particular increase. I will say, all our ICAP chargebacks are pursuant to a federal plan that our controller's office puts together probably June of each summer. And it's all prescribed by Circular A87 of the Federal Office of Management and Budget.
Legislator Morris, did you have a question?
Regarding Monroe Community Hospital, similar question that my colleagues have asked about other departments. Are there mandated versus unmandated costs for the hospital?
Yes, Madam Chair, there are. Again, we have not run department-specific calculations, so that's something we would have to follow up on.
Thank you. And again, through the chair, on page 220, there's a stated objective of keeping the average census on the pediatric unit under 80%. What has the average been this year?
Madam Chair, I'm going to have to bring in our experts from the community hospital.
Through the chair, can the question be repeated, please?
Sure. On page 220, it stated an objective of keeping the average census on the pediatric unit under 80%. And the question was, what has the average been this year?
Through the chair, the goal is actually to keep it above 80%.
Oh, above,
And
I'm sorry,
currently,
excuse
we
me.
are at 4.54 for the year out of 5 beds, so we are over 80%.
It's over 80% this year, so far this year. Thank you. Again, through the chair on page 222, why was the number of patient days so much lower than the estimate? Follow-up would be, is this due to a lower than expected amount of COVID patients or some other related reason?
Through the chair, it's actually based upon a census that we were not 100% accurate on projecting for last year. Obviously, as Mr. Franklin mentioned during the budget presentation, nursing homes are in flux with determining an appropriate census. And that is why for 2023, we did lower our estimated census, so our estimated patient days.
If the hope is to have a lower patient census, why is the number of projected treatments so much higher?
Through the chair, based on patient acuity, so nursing home residents are becoming more complex. We actually see an increased need for services like PT, OT, and respiratory therapy.
A few appropriation questions, Bob. Through the chair, on page 549, is the budget reduction for temporary help and overtime going down due to a plan to hire more full-time staff?
Madam Chair, the hospital does have a budgeted increase in its headcount, an increase of 12 FTEs. But I will say, we know with in today's state of nursing services, regardless of title, CNA, LPN, RN, it's important that we maintain flexibility, budgetary flexibility with MCH, and have probably more freely worked with them to shift budget lines between salary expense, overtime, temporary help, and contracted nursing staff.
Again, through the chair, why is the cost of computer equipment maintenance going up so much? On page 549 again.
Madam Chair, before I give the wrong answer, I'm going to tell you, we're going to dig up what the full answer may be and respond accordingly.
And again, through the chair, why are, again, on page 549, why are taxes assessments going down by $500,000?
Madam Chair, this is really, believe it or not, when you stay at a hospital, the state taxes us on the patient stay. So this is related to patient revenue. Lower census, lower taxes and assessments.
Thank you. And again, through the chair, what is the MMIS weekly shares report line item, and why is it going up by more than 3 million?
Madam Chair, so don't be fooled by the name of the account. It's our, we use the same account. It represents our required payments to the state for Medicaid. This particular line item represents the local share of the Medicaid upper payment limit. We have to pay $1. New York State collects $1 and then returns $2 to the community hospital. And we are, per leading age, they are telling us to project an increase going forward.
Again, through the chair, on page 550, are there lower grocery and pharmaceuticals budgets due to the goal of a lower patient census?
Yes, Madam Chair, and just a quick comment. This is one of those variable costs that are coming down to a lower census, but the dollar amount we budget per resident is slightly increasing.
And again, through the chair, on that same page, why are the principal bond costs dropping by about $1 million, but the interest raising by about 60,000?
So, Madam Chair, when we borrow, it's called new money issuance, we actually don't have to make the first bond principal payments until 2 years after the issuance, but we have to pay interest starting immediately. So for new issuance, you'll often see a bond principal going down, but interest going up. Hospital's been much better managing their debt. So kudos to them for that.
Thank you. And through the chair, on page 551, why is there a new line item for interdepartmental charges with the law department?
Oh, sorry, Madam Chair. I was looking at the ICAP lines, but yes, there is a new non-ICAP charge from law, and that's really to reimburse the law department for the lobbyist activities.
And again, on through the chair, on page 551, why is the interdepartmental charge with purchasing going down so much?
Madam Chair, again, purchasing follows our ICAP plan, indirect cost allocation plan, and there's 2 steps. That's why we have an ICAP 1 and ICAP 2. And there is a mismatch between how we budget and how Controller's Office actually charges out those. And this is just mathematically derived based on the number of purchase orders issued, the number of price agreements, et cetera, et cetera.
Thank you. And through the chair, some revenue questions on page 686. Is the projected lowering of patient revenue due to the hope that the census will go down?
Well, Madam Chair, it's not really a hope that the census will go down, right? It's a reflection of the fact that in today's society, there is a hesitation to place loved ones in a nursing home. So we're just trying to better reflect where the census will actually be.
Thank you. And through the chair again on page 686, why is the requested fund balance revenue so much lower for the 2023 budget than in the 2022 amended?
Madam Chair, this was really in both years entirely related to the use of our reserve for bonded debt.
Thank you. And again, through the chair, where's the extra 6.6 million coming from in charges to other governments?
Madam Chair, this is the opposite side of the MMIS weekly shares. So as the MMIS, our local share of the UPL payment goes up 3.3 million. Charges to other government, this is where we reflect the revenue. So that goes up 6.6 million.
Thank you. And again, through the chair, why is there an additional 1.1 million requested from the general fund beyond last year's budget?
Well, Madam Chair, that really reflects the operating circumstances of Monroe Community Hospital. And there is rather than fluff up an estimate of patient revenue, we felt it better to reflect where we think the census is going and support the hospital with the additional general fund transfer.
And then again, through you, Madam Chair, page 730, some personnel-related questions. Why is the hospital finance administrator dropping from a group 21 to group 20?
So, Madam Chair, I'm going to tell you that the position should have never been a group 21. We have finance administrators at our airport, our Department of Human Services, our Public Safety Office, and the Environmental Services Department, and they are all group 20 positions.
And again, through the chair, so that's just going to mirror the other areas as you mentioned?
It will, Madam Chair.
Thank you. And again, through the chair, where were the plumber and supervisor of building maintenance positions formerly located, if anywhere, or are these new?
Madam Chair, they were located in an outsourced contract with Crothall, and the hospital is seeking to insource a number of those functions.
And follow-up question again through the chair, is that person taking a demotion?
No, Madam Chair, it'll be I believe there are staff at Crothall who would like to become county employees, but there also may be some recruitment.
Thank you. Again, through you, Madam Chair, following up regarding some personnel items, why is there a one less full-time nurse manager and one less PD nurse manager?
Through the chair, with a reduction in estimated census, and we also have temporarily closed units, we don't require the number of FTEs for the nurse managers that we did before.
Thank you. And again, through you, Madam Chair, where did the 6 assistant nurse manager positions come from?
Through the chair, we did have registered nurse 2 positions in the 2022 budget. However, we had a lot of difficulty recruiting into those positions. So we went through and overhauled to attract and recruit potential staff into those positions.
Again, through you, Madam Chair, why are there 9 additional registered nurse 2 positions with only 2 less registered nurse positions?
Through the chair, there are registered nurse 2 and then registered nurse positions. So they are actually separate functions, and we created the position of registered nurse 2 to create a career ladder. So as far as the registered nurse 2 positions, those were used to create the assistant nurse manager positions. The registered nurse positions weren't touched for the assistant nurse managers. We have historically had difficulty recruiting into registered nurse positions as well, and so that is why we reduced those positions slightly.
Thank you. Through you, Madam Chair, again, where did the 5 LPN 3 positions come from?
Through the chair, those were actually created in May 2022 when we attempted to create career ladders for the CNAs, LPNs, and RNs. They acted in a supervisory capacity, and those were created from regular LPN positions at that time.
Thank you. And a last question, again, through you, Madam Chair. Why is there only 1 utilization review nurse position as opposed to the 7 from last year?
Through the chair, the functions of those positions have actually been shifted to nurse manager positions. So we're slowly starting to integrate those functions into nurse manager positions.
Thank you very much. No further questions, Madam Chair.
I do have a question myself, and whether this is for Mr. Franklin or the director. So during your earlier presentation, you made mention of you are not continuing with a contract with MCH around the ventilators or the ventilator unit. Can you touch a little bit more upon that? And then will that have an impact on the MCH budget if they decide not to do the contract and whatever professional services that we plan to do?
Through the chair, when those units were created, a contract was engaged with URMC to provide medical, nursing, and respiratory staff to those units. The intent for many years was that MCH would take over internal functions of the respiratory nurse staffing. And together with URMC, we decided that this was the time to make that move and make that transition. Through the budget process, we did account for increasing personnel to account for internal positions to staff those units and have been recruiting towards those positions towards the end of the year. You'll see later on that there is a referral for MCH to engage in contracts with nurse and respiratory staffing agencies to supplement internal staffing for those units.
That explanation. Legislator Brew.
Do you anticipate any interruption in respiratory care services with the transition of the U of R exiting and the new staffing provided by MCH?
Through the chair, we have really been diligently planning for this, and URMC actually utilized primarily agency staffing themselves as part of the contract. So there really isn't much of a change of the services that were provided on the unit. It was really kind of a middleman to the services themselves. So we have been planning. Our census has been pretty steady, and as of right now, we are okay to keep it where it is and move forward into 2023.
Okay, and follow up to that response through the chair, if I may. You mentioned the census. What is the current census or maybe the rolling average of the census in the respiratory care unit?
Through the chair, our ventilator average has been 15.9 for the year. As of today, we had 13.
Okay, thank you.
Through
Legislator Dunbar first.
Right, through you to through the chair to the administration, if you could just add, Mr. Franklin, the veteran services mandated versus non-mandated to your, to the list there. And through the chair to the administration, how many veterans live in Monroe County and in the city of Rochester? And how many of those veterans do we expect to serve at the Anthony Jordan Health Center? Specifically the Rochester veterans and how many we plan on serving there.
33 to 34,000 veterans live in Monroe County. I do not know, but I will get back to you on the number that actually live in the city of Rochester.
And do you also have a number, or can you get us a number that we expect to be served at the Anthony Jordan Health Center?
Yes, I will.
Appreciate that. Through the chair to the administration, we are doubling the ecotherapy, which is great, and I'm very, very happy about that. How many additional veterans are we planning on servicing with that?
Maybe an additional 36 veterans if all the cohorts are full.
Great.
Excuse me, before you start, can you please address everything through the chair?
Through the chair, on page 339, why was the actual client contract number so much lower than estimated in 2022? And why is it estimated to be so much lower in 2023 than the 2022 estimation?
Through the chair. So in previous years prior to 2022, we did a lot of estimating on client contacts. Just as an example, I got a phone call yesterday from a veteran who was asking a healthcare question, and I had to refer him to the Veteran Service Center at the Calkins Clinic because we don't deal with healthcare in the Veteran Service Agency. It's a different function. So what the director decided to do for 22 and beyond is that we're going to be more definitive with counting of contracts using our software called VetRespect. All of the veteran service officers have been directed to record those contacts in VetRespect, and the numbers go down because VetRespect is for veterans that we are consistently serving, not just those like one-off calls.
Great, thank you. Through the chair, on page 552, what is the temporary help that has not been budgeted for in the past?
Through the chair, that temporary help is a part-time employee at the Veterans Court that is assisting the Veterans Court with administrative functions. It is funded through the BJA Veterans Treatment Court grant.
Great, thank you. Through the chair, also on page 552, is the software licensing a one-time fee or is that a recurring fee?
That is to the chair, that is a recurring fee for that VetRespect program I mentioned earlier. It had previously been listed incorrectly under 504285 maintenance computer equipment. We corrected that for 22, correction for 23, and it is a recurring license that allows us to access the online database.
Thank you. Through the chair, also on page 552, what is the clothing fund used for?
Through the chair, for 2023, we're going to be purchasing Monroe County Veteran Service Agency logo shirts and jackets for the employees to use at community outreach events.
Great. Thank you. Through the chair, also on page 552, why is the cost of mandated training so much less this upcoming year?
Through the chair, in previous years, that mandated training had happened in person, which required us to pay transportation for one of our service officers to attend the training, but it has gone down significantly because it's just fees for training and online services.
Gotcha. Thank you. Through the chair, on page 553, why are many of the interdepartmental charges projected to be so much higher?
So, Madam Chair, a lot of these, you're looking at internal service chargebacks that are really changing. The biggest ones are within our Information Services Department. As I commented, their budget for 23 is really expanded. So mathematically, all the user departments are going to see increases as well. Not tremendous changes. The other next one looks like our Health and Human Service Building, which is Westfall Road. The VSA is right next door to that, and they share utility costs. So with the increase in utilities, you're seeing an increase in that chargeback. Those are the big items, Madam Chair.
And thank you. Through the chair, also on page 553, why is liability insurance almost doubled?
Madam Chair, the cost of liability insurance skyrocketed this year. And that's going to be a continuing trend into 23 as well.
Awesome. Thank you. Through the chair, on page 339, I see federal funding has remained the same. Are there any plans to seek any further funding from the federales?
Through the chair, that is the Veterans Court grant at $137,500 per year, a total of $550,000 for that grant. That grant expires at the end of this year. We have submitted a request for an extension for 1 year due to the reduced workload for the Veterans Court during COVID. We do not know if there will be additional funding available for the Veteran Court grant. We have a request for information to the Bureau of Justice Assistance to see about submitting another grant proposal for future years.
Great, thank you. And through the chair, on page 739, what is the new position of Veterans Court Community Liaison's responsibilities going to be?
Through the chair, that is the position I mentioned earlier that is funded by the BJA grant, the part-time employee who's assisting them with administrative functions.
Thank you. I'm sorry, it's all yours now. Hey.
I'm sorry, thank you. Through you, Madam Chair, to Director Tallow, if she's still at the table. I just want to go back to the pediatric ventilator unit. You mentioned that currently it's being staffed by contract workers. I know you don't have a crystal ball. So is it your expectation that those contract workers will become county employees?
Through the chair, we actually are working through a waiver so we can solicit current staff on the ventilator and pediatric unit to become internal MCH staff. We have had some success also in bringing external candidates in as well.
That's great. That's all I had. Thank you.
Thank you, Madam Chair. First, I just want to commend Director Franklin on his command of the budget and all of the implications of it. So I appreciate that. I actually also have a question for Director Tallow. Just this past month, this honorable body passed legislation that creates a program for nursing homes to get additional patients, more complex patients, and get reimbursement. So a question in two parts. Will MCH be eligible to participate in that program once it's stood up? And if so, will you be pursuing participation?
Through the chair, we're still considering whether MCH will participate or will not participate in that program.
Thank you.
Thank you, Madam Chair. Through you, I had a lengthy list of questions for Director Franklin, but coincidentally, it was matched exactly by the questions my colleagues asked. So I just have one additional one. As far as healthcare, you mentioned the rising cost of benefits. And are you able to say in approximate terms of percentage, not dollars, the increase in our costs for healthcare benefits in the coming year?
Yes, Madam Chair, it looked like about a 5.8% increase.
Thank you. That's all I had.
Legislator Brew.
I had one more question for Director Tallow, if I may.
I feel like you're messing with it.
The poor thing.
Yeah.
And talking about the respiratory unit through the chair to the administration, what is the exit date of the U of R services
Through the chair, the contract end date is December 31st of this year.
of this year? Okay. And a follow-up question to that to the chair of the administration. So that would be, at that time, we would be employing or utilizing the temporary services as listed in our referral tonight to fund that, correct?
Through the chair, correct.
One more follow-up question, then I think you'll probably leave permanently. So when the temporary staffing takes over and staffs respiratory care unit through the chair, how long do you think the transition period would occur from the time that they provide the temporary staffing to a point where MCH staff may be capable of providing services within in-house?
Through the chair, that's actually already occurring. So we are bringing in and recruiting LPNs, RNs, and CNAs and RTs to take that on now. Based upon our census and the positions we have in our budget, we were able to take vacant positions and recruit folks into those positions and have them assist on other units while being trained on the ventilator and pediatric unit. So there will be a combination of internal staff ready to go as of 1/1/23, in addition to being supplemented by agency staff as well.
Okay, thank you very much.
Are there any other discussions around the budget? All right, thank you, Mr. Franklin, for your presentation, as well as your answers, as well as all the department heads that were here tonight to answer those questions as well. Okay, so the next item on the agenda is the approval of minutes. You have the October 25th, 2022 minutes before you. They will stand approved unless the clerk is notified of any changes by the end of day. Next item on the agenda is new business. Mr. Clerk?
Referral 22-0393, amend Resolution 266 of 2019 to accept additional funding from Columbia University for the Healing Communities Study Program.
Moved by Legislator Brew, seconded by Legislator Dodorfer. Is there any discussion? All those in favor, please signify. Oh, sorry, Legislator Brew.
Madam Chair, I did have a couple questions here, as if we haven't asked enough questions already tonight, but to the chair, do you have a statistics for the program's effectiveness thus far? And to the chair, if
Madam Chair, the effectiveness of the program has yet to be proven. The current Columbia study is being done in waves, and they have just completed the first wave. We are now in wave 2, and so we're awaiting the results of wave 1.
okay, thank you. And next question, through the chair, what is the program's end date in the 2019 resolution?
It's indicated that excuse me, to the chair, that's indicated that it's March 2023.
Thank you. Concludes my questions. Thank you.
Is there any other discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 22-0394, amend Resolution 291 of 2020 to accept additional funding from the New York State Department of Health and authorize a contract with Reliant Staffing Systems, DBA Career Start for the Children and Youth with Special Healthcare Needs Program.
Moved by legislator Dondorfer, seconded by legislator Morris. Is there any discussion, legislator Dondorfer?
The chair, where's the additional 7,734 going?
Through the chair, that will go to other program costs, including educational materials, printing, translation of our educational materials, and that sort of thing.
Thank you. And through the chair, what other organizations submitted bids?
Through the chair, there were several organizations that submitted bids. The contract was awarded to both Reliant DBA Career Start and Caswood. And the reason we're sticking with Career Start on this particular one is because our current part-time contracted person has been with us through Career Start for several years. And so rather than asking her to switch agencies, we would like to stick with that agency.
Understood. Thank you.
Is there any other discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 22-0396, amend Resolution 154 of 2022 to accept additional funding from Health Research for the Expanded Partner Services Initiative.
Moved by legislator Morris, second by legislator Brew. Is there any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 22-0397, acceptance of a grant from the New York State Governor's Traffic Safety Committee for the comprehensive toxicology testing in driving under the influence and driving under the influence of drugs program, Office of the Medical Examiner.
Moved by legislator Brew, seconded by legislator Dondorfer. Are there any discussions? Legislator Brew?
Why did the grant amount decrease?
Madam Chair, the amount decreased because we always base our grant proposal on the number of cases that we've had for DUI in a period leading up to the time of the grant proposal. And there's obvious variation from year to year in how many cases that come in. And so to keep our estimates as accurate as possible, we use the most recent data, but it does vary. So
Thank you. To the chair, thank you.
Any other discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 22-0398, acceptance of a grant from Health Research for the Overdose Data to Action Program, Office of the Medical Examiner's Forensic Toxicology Laboratory.
Moved by legislator Dondorfer, seconded by legislator Morris. Is there any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 22-0399, authorize a contract with Nurse Family Partnership, National Service Office for support of the Nurse Family Partnership Program.
Moved by legislator Morris, seconded by legislator Brew. Is there any discussion? All those in favor signify by saying aye. Any opposed? Item carries. Next item.
Referral 22-0400, authorized contracts to provide temporary ventilator and pediatric unit nursing and respiratory staff at Monroe Community Hospital.
Moved by legislator Brew, seconded by legislator Dondorfer. Is there any discussion? Legislator Brew.
Through the chair to the administration, how will the amount paid to each vendor be determined?
Oh. There you go.
Am I on?
Yep, you're on.
Through the chair, can the question be repeated?
Yes, through the chair, how will the amount paid to each vendor be determined?
Through the chair, that really depends on their availability and flexibility to meet the needs that are required of the facility and those units. For example, full-time shifts will be desirable, followed by hourly per diem shifts.
Thank you.
Other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 22-0401, acceptance of additional funding from the New York State Office of Children and Family Services and amend Resolution 307 of 2022, authorize contracts with not-for-profit agencies for Rochester Monroe County Youth Bureau programs in 2022.
Moved by legislator Dondorfer, seconded by legislator Morris. Is there any discussion? Legislator Dondorfer.
To the administration, can you please explain what is causing a substantial increase in funding over what was passed earlier this year?
Can you please make sure you're using your mic, the legislator? Thank you.
Please explain what is causing the substantial increase in funding over what was passed earlier this year?
Madam Chair, in 2022, we received additional tons of funding under what OCFS was filtering through the Youth Bureau for, if you remember, a lot of anti-violence funding. They were coming in several different ways at different amounts. So that also contributed to the increase that you're seeing.
Thank you.
Is there any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 22-0402, authorized contracts for the provision of mental health, developmental disability, and alcoholism and substance abuse services in 2023 for the Monroe County Office of Mental Health.
Moved by legislator Morris, second by legislator Brew. Is there any discussion? Legislator Morris.
Thank you, Madam Chair. Through you to the administration, could we get a list of the RFP respondents?
Madam Chair, yes, you can.
Is there any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 22-0403, authorized professional services contracts for the Monroe County Office of Mental Health Socio-Legal Center.
Moved by legislator Brew, seconded by legislator Dondorfer. Is there any discussion? Legislator Brew.
Yes, to the chair, were there any other RFQ respondents?
No, there was, Madam Chair, no, there was not.
Okay. Next question, if I may, through the chair, how will it be determined how much money each psychiatrist receives?
Madam Chair, if I can get back to you with that information, we'll look into the.
Through the chair, you certainly may.
Mhm.
Through the chair, why is the percentage completed on time only 80% of the time?
Prepared for that. I'll get back to you. Thank you.
Thank you. Concludes my questions, madam.
Any other discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 22-0404, authorization to contract for Monroe County Office for the Aging programs in 2023-2024.
Moved by legislator Dendorfer, seconded by legislator Morris. Is there any discussion? Legislator Dendorfer.
RFP, RFQ respondents for that also.
Madam Chair, absolutely.
Is there any other discussion? All those in favor, please signify by saying aye.
Aye.
Any opposed? Item carries. Next item.
Referral 22-0420, acceptance of funding from the New York State Office of Addiction Services and Supports and amend Resolution 517 of 2021 as amended by Resolutions 122 and 174 of 2022, authorizing contracts for the provision of mental health, developmental disabilities, and alcoholism and substance abuse services in 2022 for the Monroe County Office of Mental Health.
Moved by legislator Morris, second by legislator Brew. Is there any discussion? Legislator Morris.
Thank you, Madam Chair. Through you to the administration, is it correct to say that the net of this is the county owing providers roughly 1.4 million more as a result of their consolidated financial reports provided?
No, Madam Chair, this is not a result of Monroe County financial liability. This is all through state funding.
One additional question, Madam Chair, through you, can you please clarify the impact of this referral on our expenses?
New York State Office of Mental Health, as managers of all three disability areas, has a quite extensive contract closeout process. We keep our contracts open easily 3, 4, 5, 6 years until New York State closes them out. Every year, there is, amongst our provider agencies, shortfalls and surpluses in the amounts originally allocated to them. So there's often adjustments made to individual contracts. Sometimes, very often, funding is left over from year to year, and New York State has us hold on to those funds until they determine how ultimately to allocate them. So this ultimately is still all New York State dollars, likely from a prior year.
Thank you. No further questions.
Any other discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Next item.
Referral 22-0421, amend Resolution 412 of 2020 as amended by Resolution 421 of 2021 to amend and increase the contract with Rochester Regional Health through its Rochester General Hospital permitted laboratories to provide clinical laboratory services for the Monroe County Department of Public Health.
Moved by legislator Brew, seconded by legislator Dendorfer. Is there any discussion? All those in favor, please signify by saying aye. Any opposed? Item carries. Are there any other matters to come before the committee? There being no other matters, the November 29th, 2022 meeting of the Human Services Committee stands adjourned. The next meeting of the Human Services Committee will be Tuesday, December 20th, 2022 at 5 p.m.